Welcome to today's webinar. My name is Anne Livingston and I will be Chair and Moderator for today's webinar for the Community Care Smart Assistive Technology Collaborative. The topic for today's session is Autonomous Movement in Assistive Technology Applications. This webinar is part of a series of sessions being facilitated by Community Resourcing for the Community Care Smart Assistive Technology Collaborative. Community Resourcing has international expertise and networks and uses these to build community care, service capacity and sustainability through empowerment, knowledge transfer, skills enhancement and research and development projects. Community Resourcing has been funded by the Queensland Government to put together an online platform for community care service providers who are interested in collaborating on issues and practices related to smart assistive technology. Today's session will be delivered by Mike McNair. Mike's in the US, in Texas, and is delivering this session remotely. Mike is the Automation and Intelligent Systems Division Head at the University of Texas at Arlington Research Institute, or commonly known as UTARI. He joined the Research Institute in October 2013, overseeing research in unmanned systems and assistive robotic technologies. Mike's current work includes the business planning, collaboration and partnering, proposal development, project oversight, particularly in the unmanned and intelligent systems and assistive technology domain areas. The cross-cutting and enabling technologies for these domain areas are a key fundamental strength of the work Mike undertakes. This work includes research and engineering in navigation, perception, multi-agent control, autonomous human-machine interfaces, manipulation, and other technologies. Mike has a Bachelor of Science in Physics from Arlington University and also holds a Master's of Science in Systems Engineering from the George Washington University. He also holds current project management professional certification from the Project Management Institute. For participants today, a little bit more about the University of Texas Arlington Research Institute. UTARI has a focus on bioengineering, advanced manufacturing and intelligent systems. It actively collaborates and is seeking to leverage the best ideas, research and technology. It works in combination with a number of faculties and is a recognised leader in autonomous systems, human-robot interaction and assistive technology. In today's session, you'll receive an overview of how autonomy-enabled technology is Arlington's Research Institute is supporting the needs of people from all walks of life. It's great to see that we're oversubscribed for today's session and have a number of national and international participants. As attendees for today's sessions, you will be actually on mute during the presentation, but we would encourage you to ask questions through the presentation by using the question pane on the dashboard to the right hand of your screen. And there will be an opportunity at the end of the webinar to have these questions answered. It's my pleasure to welcome Mike to today's webinar. Good morning, Mike.
Good morning, Anne, and thank you very much for this opportunity to come speak with folks here. I want to thank the Community Care Collaborative and Community Resourcing for this opportunity. It's definitely my privilege to be able to be invited and to speak to all of you. What I'm going to do is begin with a big picture look about assistive technology in general, but then move into autonomous systems. And I understand this is not going to be a technical presentation, but what I'd like to do is instead have the opportunity to describe some key technologies that really could benefit the assistive technology world. So when we start to look at this and begin to look at the big picture, one of the things we learned was we asked the question, what and where are the needs? But very, very quickly we began to wonder, is that even the right question? We realized that it's a good question, but we also realized that it's very difficult to get consensus on any kind of an answer. So maybe the better question is, which needs, if addressed, can have the widest impact? We also thought that was a good question, but realized very quickly how exclusive a question that is. How we include some people and some needs and exclude others. So we realized that that didn't have the appeal or the impact that we were really desiring. So then we asked the question, well, exactly who are we trying to benefit? But as soon as we asked that, we realized we were leaving some people out. And we also realized that really everyone has some kind of need. Everyone can benefit from technology to some degree. So as we moved along in this, we then realized that we had to ask some more questions, and our approach had to change a little bit. So maybe what we really need to ask is a series of questions. For instance, what needs to be done, what are the resources we need, and what's our timeline? It almost sounds like that's almost too practical, because we definitely want to have a set of solutions that are usable by people in whatever condition and whatever state they happen to be in. So then we realized, okay, maybe this. Maybe the first step is really just acknowledging that everyone could stand to benefit from some amount of technology. That the needs are just as unique and individualized as the people that we're trying to help. We have to realize that there are really limited resources. And there really are some needs that have to be addressed now. Some needs that can be addressed later. But people do have a need right now. So I'm going to relate a story to try to help illustrate the point. I don't know if you all have heard this story before, but it's a meaningful one to me. It's called the Starfish Story. So a young man is walking along the ocean and sees a beach on which thousands and thousands of starfish have washed ashore. Further along, he sees an old man walking slowly and stooping often, picking up one starfish after another and tossing each one gently into the ocean. "Why are you throwing starfish into the ocean?" he asks. "Because the sun is up and the tide is going out, and if I don't throw them further in, they will die." "But old man, don't you realize there are miles and miles of beach and starfish all along it? You can't possibly save them all. You can't even save 1/10 of them. In fact, even if you work all day, your efforts won't make any difference at all." When it comes to assistive technologies, it's very easy to find ourselves in this kind of situation. What we have to do is realize we can't be ineffective. We have to be effective. We cannot be fearful of the size of the task. We have to do something. So the story continues. The old man listened calmly and then bent down to pick up another starfish and threw it into the sea. What's important to realize is that in doing that, that old man made a difference to the one starfish. And that's what's important when it comes to assistive technologies, when it comes to reaching out to people that have needs. Because the problem space is huge, but we just have to start. We just have to start making a difference. So let's dream a little bit, but let's put the dream into a practical perspective. It's important to take a pull mentality instead of a push mentality. In other words, we can't tell people necessarily what they need, but we should be able to listen to what they need and inform them of options. So we need to pull the solutions from the people that we're trying to help. It's important to address the needs of all the stakeholders. It's very easy to look at just the people with disabilities. But we also have to realize that there are medical staff, caregivers, even home builders, insurance, regulators, lawmakers, and the list goes on. So the list of stakeholders is large. But we also have to realize that R&D, research and development, takes time. And we need to be able to envision what the solutions could look like 2 to 5 years in advance. And I don't want to say this is most important, but it is certainly important. Is we have to look towards what is commercializable. What can we actually get in the hands of people? We need to move our solutions from the lab into people's homes, into people's living facilities. So if we look at technical stumbling blocks, what do we see? It's easy to ask ourselves how many disabilities are there and which ones could be positively affected by technology. We could ask ourselves which current solutions address the disabilities, or what even about personal preferences? Even if we have a solution, do people want it? From a technical viewpoint, we can create devices. We have lots of really great people that know a lot about disabilities. And in one sense, these really aren't the stumbling blocks. In a very real sense, it's almost a business problem. What we find ourselves facing are small targeted user populations. It's almost as if they're niche markets. A lot of times our users, they have limited income. They cannot spend a great deal of money on some of these solutions. We also realize that there are issues with risk and liability. And finally, we understand that we have to create solutions that are acceptable to our users. Because if we don't do that, we failed. So we have to be focused. We have to create solutions that are scalable. We have to create solutions that are adaptable. And that is a key to success. So let's begin narrowing in on autonomous or autonomy-enabled solutions. So the WHO, in all of their international classification of functioning, disability, and health, if you look at their categories, they have 27 categories related to transportation, 24 categories related to mobility. When you look at these and look at what's common across them, you can see that there are some interesting categories, some interesting characteristics. When it comes to being able to move people and move things, we need to be able to do this indoors and outdoors, not just for assisted use, but also general use. Not just for private use, but also public use. But people also want these solutions as a cultural adaptation. They also want these solutions for recreation and sport. It's not just purely transportation. But there's also the component where we have to have these services working within existing systems and policies. People want flexibility. Mobility is not just the option to reach a destination. So it's very clear that when we look at these solutions, we have to take a very holistic approach. We have to focus not just on the technology, but the people using those technologies. We have to see the bigger picture. But as we do that, we're going to ask ourselves, how mature is the technology? So this slide is geared just to give you an idea of some of the technologies that exist and where they happen to be. So single-purpose robots already exist on the market. You can go off and purchase vacuum cleaners, window cleaners, lawnmowers. They're all robotic. But they're expensive, and some of the multi-purpose robots, they're just generally not available. So commercially, we're stuck, if you will, with a large number of single-purpose robots. The ability to navigate or move around in an autonomous way initially started with military applications, and it's moving to what are called smart cars, driverless cars. But really, those work well in very low traffic, low people density environments. They don't work well with bad weather, and if it's a busy environment, they don't work very well either. With human-machine interfaces, we've got displays, we've got haptic devices, we've got oral cues, we've got a number of technologies But how do we keep people from feeling a sense of data overload? And how much data is too much data? When it comes to autonomy, we have cars that are being developed with new sensing systems for braking and parking, but they still require the human in the loop. And then finally, when it comes to regulation and liability, we're really at a very immature stage. There's very little clear regulation, very little liability understanding and risk analysis in some of these technologies and some of these solutions. So to give you a quick understanding of automation versus autonomy, this table gives you a sense of this, but let me give you an example that might just drive the point home. Imagine you have an automatic dishwasher in your home. That dishwasher itself is an example of automation. You can spin a dial, you can make different selections, push different buttons, different cleaning cycles, and the dishwasher does what it's designed to do. That's automation. But imagine a dishwasher that senses how full is the dishwasher. How much stuck on food is there on the plates? What types of dishes are in the dishwasher? Now we begin to look at something that's more autonomous because it has built-in sensing and decision-making. What if we took it one step further? I don't know about you, but after a large meal with guests, I have a large number of dishes in a kitchen sink. What if I had a device that could take the dishes out of that sink, arrange them in my dishwasher, sense what kind of cleaning was needed, dry the dishes afterward, and then put them away in a cupboard? Now that's a lot of autonomy. So that's sort of an idea of the spectrum, a sense of the spectrum from automation to autonomy. And really what you find as you look across this is the level of human interaction. Automation requires some amount of involvement by the person. Autonomy requires less and less direct involvement from the person. What we find with assistive technologies is we always want a person in the loop. We always want a person involved. So what exists today with assistive technologies? There's a number of sensors, appliances, powered wheelchairs, even Skype. You can look at braille devices, audio-visual sensors, wearable technology, smartphones, and the list goes on. But when you look at mobility, we're looking at walkers, powered wheelchairs, scooters. But what can we do to help people be more mobile, to do the things that they want to do and to get around town or to see others more easily? So really what we want to do is we really want to review what we need and what's wanted. We need to have solutions that are tailored for the individual. We need to have solutions that are low risk and low cost and easy to use. So really what autonomy brings is adaptability. It offloads some of what the person needs to do in order to use the machine. So in terms of enabling technologies, there's a number of enabling technologies available on the market. We have telepresence robots. We have small unmanned air and ground vehicles like drones and ground vehicles. We have driverless automobiles, different kinds of sensors, data analytics, and again the list goes on. Technology has taken off and has created a wide variety of technologies that are available. And so how are these technologies usable? Well, over time, people are no longer constrained to just their home. They can now get out, whether they are able to drive, for example, or not. We want to be able to increase social connectedness. Imagine telemedicine and remote services, being able to age in place. Imagine being able to go shopping, and instead of pushing a cart, you have a cart that follows you. And then there are other solutions, things that help people just go about their daily lives. So let's look even further. So with time-saving appliances that many people have, those are good, but smart devices might increase their efficiency. Smart homes are good, but imagine this. Imagine a smart community that would make those smart homes an even better option. Telephones and Skype are good, but what about telepresence, having sort of a Skype on wheels, if you will? And likewise, public transportation and transportation modes are good, but what if we could introduce some amount of autonomy into those transportation options? So that's the kind of thing that we are looking at here at UTARG. Some of our core technical competencies include navigation and machine vision and robotic-human interaction. We have a lot of technology and a great deal of knowledge that we can reach back into our faculty with. We're very active in consortia and other organizations. We're partnering, for teaming, for networking. We're constantly on the lookout for opportunities to work with others. So one thing to note is we are not only working with our engineering-related faculty, but we're working with nurses, kinesiologists, people in social work, psychologists. We even have work going on with our theater arts faculty. So it's wide-ranging, trying to get that sense of a person and their actual involvement in needs. We have ongoing interest in smart communities with traffic management, driverless cars, small unmanned air vehicles, drilling down into smart homes, being able to navigate indoors and around furniture, smart wheelchairs and smart beds, and then with individuals with autonomy-enabled movement assistance and telepresence. And we do all this to help people become more mobile, more active, more social, and ultimately more independent. And we really want to extend, make sure these kinds of options are available to all people. So as a way of wrapping up, we started the presentation with these questions. And I'll put them back up here on the screen. So let's see how we're doing. The vast majority of people desire some amount of mobility. What we've realized is that everyone can benefit from that convenience of being able to be mobile. But people with disabilities can benefit from the independence that it brings. There's plenty of room for invention and being creative, but there really is a real need to innovate and to enhance what we already have. Some solutions exist now, others definitely still need work. And clearly, autonomy allows for adaptability, but the neat side effect of this is that adaptability allows for tailored solutions. And when you go back to the business case, that's where a lot of the cost is. So if we can introduce autonomy, we have a ready-made approach for creating tailored solutions at a lower cost. So those are the slides that I have for you. I want to thank you all very much for the opportunity to speak. And Anne, it's back to you.
Thank you very much, Mike, for a really comprehensive overview of the work that you're undertaking at University of Texas. I'd encourage the participants in attendance, if you've got some questions, now is the time to put them in your question tray. I've already received during the course of the presentation 2 questions, Mike, so I'm going to start off with those while I ask participants if there are others that they want to ask you. Mike, this is probably a question you get asked a lot, and it's certainly a question that Australia tackles with, particularly in respect to our workforce issues and shortfalls and our workforce development considerations. But Paul from Winton Winton's a country area in Queensland, has asked a question about whether robots and autonomous applications will be replacing jobs.
Well, I am indeed frequently asked that question. And really, the answer is very simple. What we need to do is think about what are people doing that robots can do better? And what are things that we have machines doing that people can do better? People are very creative. People want to use their creative and imaginative capabilities. People want to have a sense of satisfaction at the end of the day. That's not so with machines. I recently visited a company here that makes brick. They actually have a person, his job is to move brick from one place to another, which could easily be done by a machine. That same person, if we rethink the process, could then manage the process instead of being the person who actually does the physical labor. So the short answer is, that's the long answer, the short answer is we need to rethink what it is that people do and what machines do, and have each do what they're good at.
Thank you, Mike. I've got another question from a member of our collaborative from Cairns area. Jen comments that she was at a recent national presentation where a researcher from a regional university indicated that technology that he'd been trialling in community care, that only about 10% of it actually had application and worked. You mentioned in your presentation that everyone can benefit from some sort of technology, and Jen wonders whether it's your experience that level of technology failure in the system, or are there other factors involved?
I would have to say that there are probably other factors involved. And my reason for that is technology is an amazing option. But we have to understand how that technology was used, what the level of user acceptance of that technology was, what kind of risks were involved in making use of that technology, and other factors. So that would be important to look at and understand.
Thanks, Mike. One of the issues that the reference group for our Smart Assistive Technology Collaborative is dealing with around the economics of investing in technology and community care service provision. Through your presentation, you talked a lot about business case development. I'm just wondering, and I have a question from Des on the Gold Coast about has University of Texas done much work on return on investment?
Yes, that is a challenge for us. Because so many of these technologies are emerging technologies, they are still very much in a developmental stage. We do actively seek commercialization opportunities and options, but right now our return on investment admittedly has been somewhat low. But considering that we have an aging population internationally, we actually see that trend changing over the next several years.
Great, thanks, Mike, and we'll certainly be interested in sharing some of the work that the Community Care Smart Assistive Technology Collaborative is doing here in respect to that return on investment and economic case for smart assistive technology. That brings our presentation and our questions to a close today. I'd like to thank everyone in attendance, and I'd particularly like to thank and acknowledge Mike, who's worked a very long day. I think you're up to about 13 hours worth of work today, Mike. So thank you again for staying back at the university late today to present this session. We've got a further 2 sessions planned for January, one on virtual reality and another one which is more a forum type session, looking at the operational requirements for selection of technology. An evaluation will be sent to all participants from today's session, and we'd encourage you to fill that out and provide us with some feedback from today's session. Again, thanks, Mike, for your involvement today, and thank you to the participants for their interaction with today's webinar.